Doctors in Alberta have a new warning for people, particularly people with pets. They are noticing rising numbers of infections from a tapeworm that humans can pick up from their dogs, as well as foxes and coyotes, but from their dogs. And as Julia Wong tells us, there are worries that this is something being underreported in Canada.
Doctors say a parasite has taken a stronghold in Alberta, infecting 31 people in the past 10 years. And they say a common source of spread is your pets. Echinococcosis multilocularis is a tapeworm that lives in coyotes, dogs, or foxes. And when those animals defecate, the tapeworm's infected eggs live in their feces, and humans can come into contact with that through their pets. People may not know for years, but normally a cyst forms, typically on the liver, and that can cause other symptoms like pain, discomfort, and jaundice. Before 2013, there was only one case in Canada in the last 100 years. And while there is no extensive national data, doctors say Alberta and Edmonton in particular is a hotspot.
Edmonton has a vibrant river valley, very green, lots of rodents, voles and mice, and a growing coyote population. And it's the coyotes and dogs, they get infected by eating and ingesting infected mice or voles, typically small rodents. So having a large population of people living next to those animals, it's likely why we're seeing a fair number of cases here.
But we suspect that more people are probably carrying the parasite and just haven't presented with symptoms yet because it's got such a long kind of incubation period. And so it's tough to say really kind of the infection rate of this parasite right now, but it certainly seems like something we should continue to be mindful of.
The condition can be fatal, but doctors say sometimes the cyst can be removed or it can be treated with medication. Doctors are recommending good hand hygiene, fencing off vegetable gardens, and deworming your pets. Julia Wong, CBC News, Edmonton.
So that is a report that certainly raised questions for us and our interest. And Dr. Samir Gupta is here to tackle this in more detail. He's an associate professor in the Department of Medicine at the University of Toronto. Welcome back, Dr. Gupta.
Thanks, Heather.
Again, this week we talk about something probably most people have never thought about and now should be aware of based on what we're seeing. Here are the words of the day. I'm ready to try them out. Ready? Okay, the parasite, echinococcosis multilocularis, and then the disease that it causes, alveolar echinococcosis. Are they close?
Not bad.
Not bad.
Alveolar echinococcosis.
Okay,
yeah.
AE. Let's go with AE because I think that's the common phraseology. Okay, first detected in Canada in 2012, but as Julia said, increasing now. There are cases in Ontario, Saskatchewan, BC, and Alberta, sort of the hot spot. Tell us more about the parasite and how it begins to affect humans.
Yeah, so it's a tapeworm. It's a tiny tapeworm, just a few millimeters in size, Heather, but it does wreak havoc in the human body. This one is actually found more in northern latitudes. As people don't usually associate parasites, think of parasites as more tropical, but this one is found in northern latitudes, some European countries, Russia, China, Alaska, continental US, and as you said, Canada. And really much more in Western Canada, particularly in Alberta. And as you heard in that report, the definitive host is a canine population, so coyotes in Canada, but also wolves, foxes, and sometimes dogs, including domestic dogs. And those animals, in turn, are catching it from an intermediate host, which is a rodent. So it's in the rodent population, including mice, rats, chipmunks in Canada. They consume those animals, they get the infection, the parasite can live inside their intestines and shed eggs, and those eggs make their way into the feces of these canines. And if we, humans, inadvertently consume some of those eggs through that feces, so, hand to mouth or fecal oral route, then we get the infection, and that's when people get sick.
Okay, a couple of things. We talked about this with a woman in Australia who ended up with a tapeworm in her brain through inadvertently consuming that in the same way she had been foraging in Australia. So it's a similar kind of transmission. I'm just going to bring back, if we can, that picture of what the tapeworm looks like, because it just gives people an idea of the size. That is actually a paper clip here, Dr. Gupta. So there's your comparator to see how tiny these are. And through that route, as you mentioned, the animal population and then on into humans. If we can take a look at CT scans, we have some still pictures and also some video here of what it does then when it gets into the human body, Dr. Gupta.
Yeah, almost exclusively affects the liver. And what you're seeing there on the left side of your screen, that sort of darker colored area, that's within the liver. That's the lesion it causes. And This is something, the liver is something is a place where you can hide things for quite some time before developing symptoms. So it can grow even for years before people know they have it. The symptoms can be quite nonspecific, just a little bit of pain, eventually some fatigue, then some weight loss. And it's sometimes hard to figure out until they have a scan, an ultrasound or a CAT scan. And initially, it's often mistaken for a tumor. It actually can look like cancer. And it's only if you think of this and ultimately do the blood test that shows that this infection is there that you realize this. And then the challenge in treating it, you can see from how large that lesion was, the challenge is that you've got to remove it. But that can cause a lot of damage to the liver. And in some cases, it's too big to remove. And then you have only medications as an option. So this can be very challenging to treat if it's advanced.
And very difficult, as you said, even to detect. So I guess the thing is to prevent. What do we keep in mind in terms of all of this?
Yeah, there was a study just last month from Alberta that suggested that more than 50% of the coyote population, this is in and around Edmonton, had active infection. Another 20% had recent infection. So this is where it's coming from. And so it's avoiding contact with those wild canines, particularly coyotes in those areas, making sure that your own pets don't have contact with them. As they said, fencing off areas where you might have a garden, or this is the case for farmers, anywhere where you might forage or you're growing fruits or vegetables, where if those animals are walking through, a little bit of their feces can get on those areas, and then you can inadvertently consume it. So obviously you have to really wash anything that you're getting from out there. These eggs can actually last up to a year in the wild, Heather, and still be infective. So you really have to be careful with that. And as you're seeing on the screen, because it's coming from rodents, you want to prevent your pet from consuming rodents. You want to avoid having rodents in your garbage, and lock that down. There's an association between coyotes consuming human garbage, human food waste, and having this infection. So you want to minimize access of those wild animals to your own human food waste as well.
If we look at some of the images again with the coyotes, it just strikes me, Dr. Gupta, that there's so many urban coyotes now. The population is increasing. These interactions are that much more frequent now. So these are these new things that we have to consider given new realities. I'm not sure if we have these pictures, but in Julia Wong's piece, you actually saw a coyote in a park with people going by on bicycles. It's commonplace now. There is some good news, I think, in that, isn't it? This does not transmit human to human, right, Dr. Gupta?
Correct. There's no human-to-human transmission, so you have to catch it from one of those exposures in the wild. But as you say, we've talked more and more about these zoonoses, these infections that come to human populations from animals, and with climate change, as you have more interaction between animals and humans, you have this kind of transmission. I think this is another example of it.
Dr. Gupta, thank you so much. They're talking about trying to develop a nationwide registry here to try to track cases and get a better understanding of this, but you've helped us understand this better this morning. I really appreciate it. Dr. Samir Gupta, see you next week.
See you, Heather.